her teeth before.
Well, my family was bad on that.
Am I on?
Yeah, go ahead, Lisa.
Oh, hi, Dr. Morse. Yeah, I was using the tooth and gum powder, actually.
You know what? Nature has so many cool tools that we can use and have fun with. It's exciting about that. The botanical world is so exciting in all kinds of ways. Glandulars are something I think that man is needing for a little while until this balance of learning that dead animals and all this stuff is not the way. But you're talking, you know, this is not considered a very evolved planet as you guys are getting that, not by the masters or anything. A lot of the masters consider this some of the ash cans of the universe, some of the cliches.
Oh yeah, first of all, I just wanted to say thanks so much for everything you do, because my skin used to be so bad I wasn't able to leave the house, like from head to toe. Like it looked like I was burnt by acid, and it's 100%. Yeah, it was so bad. The other patients in the hospital were like, "Were you in a house fire? Were you burned by acid?" It was just,
oh my God.
Yeah, and it's like my eyes would swell closed, and it, like my skin would just open, like, and just weep. It was just like, and it's 100% completely gone now.
Wow.
Yeah.
Good. I'm telling you, my heart goes out to you, honey. Good job.
It was tough. It was a tough time.
Yeah. Well, I have not seen anyone that couldn't clean up their skin, because it is a huge eliminative organ. And once you realize that and what you've been doing on yourself and clearing it up and all that, it's just a beautiful thing to see. But the suffering, I was telling you on that last video about the guy next door, and then a little rash. Oh, we got Claritin for you. Read the side effects of Claritin. It's on TV. I mean, it's just crazy.
Yeah, they were going to give me chemotherapy cream in the hospital. That's when I discovered your channel, because that was the last straw. I was like, I can't do this with Western medicine anymore. So I looked up on YouTube, how can I get rid of this? And that's when I found your channel, 2016. So
chemotherapy. Can you imagine the consciousness of this? And I've been showing you what a chemotherapy spill looks like on the skin. Yeah. And of course, you see what it looks like burning from the inside out. So good job, sweetie. I'm glad you stopped and didn't do the chemo, because they're giving chemo for RA, skin problem. They went nuts.
Yeah.
Literally went nuts.
Yeah, but I wanted to talk about bones. So like all the women in my family have bone problems, but also the dogs. Like I almost feel like we manifest like the dogs into our lives that are going to mirror us. Like, you know, you have a Shih Tzu.
Yeah.
You have a Shih Tzu, don't you?
I had a Shih Tzu.
Oh, is he gone?
He's since passed. But I have it's a multi-poodle. It's a cross between a Maltese and a poodle. And then I have a little 6-pound Chihuahua, little white thing.
Oh.
Yeah, I worry a lot about that, because all these protein diets that they have is just leaching calcium. That's why you see the hip dysplasia. And then, of course, we know that canines universally have kidney problems. So then they have the lymphatics. They get the tumors. And then, of course, some of the crap people feed them, cheeses and stuff like that, swells their lymph nodes and stuff like that. And it's like, and they don't know what the lymph nodes are for. So when they start cutting them out, and it's like, oh, Lord. So yeah, always know that rebuilding bones is an alkaline experience and a parathyroid, and I'll use the word pituitary as well, experience. Now, again, you've got to be able to get that body more hydrated in an alkaline state. It's hard to rebuild tissue sitting in an acidic medium. And where you have the draw of calcium, you know, interstitially, you have stagnation lymphatically. And therefore, you're seeing that draw, that loss of calcium, just like joints and things like that. You go running, all this lactic acid and all these acids, all the acids by increased respirations and things, and then you can't get them out. So you can imagine year after year doing that, what's going to happen someday? Exactly. And that's what we're seeing. And then the genetic passing of all this, it's a nightmare. And you guys are the only ones that get it, really. And so the world needs you guys badly. Especially people like you that took themselves, Lisa, from the worst skin conditions in the world to a beautiful looking woman like yourself. I'm telling you, it's great.
So like, I just wanted to ask about So we have 3 Shih Tzus in our family. One of them is 12, one's 11. The 11-year-old has hip dysplasia. The 12-year-old's had 2 knee operations on each knee. She's had like, you know, like bones rubbing and cruciate ligaments, you know, the bones slipping. But he's operated twice and he's made her worse. He's given her a lot of painkillers and stuff like that. And I'm trying to get my mom to detox the dog. But the problem is I'm finding the same thing with the dogs as it is with people. It's like, it's the food addiction is like the biggest obstacle, because like the dog won't eat fruit. She doesn't like it, you know, and she doesn't like any raw food. So my mom just doesn't want her to like starve. She thinks she'll starve. So she just feed her like rice and meat and stuff. And but even like outside of that, like even with myself sometimes, like I feel like there's things that I still haven't healed in myself, scoliosis and everything. But it's just that connection to the cooked food and like the severe addiction to cooked food. It's so hard to get over. And whenever I try to even do like a candida killing myself, the symptoms are just, I can't even deal with them, you know. So like that's what I'm finding is like is blocking, like with myself and with the dogs. We can't get the dogs to eat raw food. And another thing as well that I was thinking about was these small dogs. A lot of them have like bulgy eyes. So like, do they have hyperthyroid? So they're going to have parathyroid problems.
Chihuahuas are known for hyperthyroid. Check them out.
So like, is there anything you can do? Because like if a Shih Tzu like has hyperthyroid going back, you know, from their parents, like, is there any hope for an individual dog? Like,
well, totally. These are omnivores, and of course they respond just like a frugivore and a herbivore. Really, they can respond really well. Problem is just what you said, getting them into a fruit, berry, or melon, or fruit or berry, or sometimes I notice a lot of blueberries in some of these dog foods and stuff, these raw foods and stuff, but they still have a lot of meat in them. And when you're trying to go after something like this, protein isn't the answer. So I don't know what to say. I know this is a universal problem. I know herbs and glandulars we use on the dogs all the time. When you get a mother like that, I'm not sure how they're, because it's their baby, and you know what I'm saying? It takes some commitment to get your dog well. But I've seen, we had a lady work for us. She took her mom's poodle, which had severe cataracts. I mean, arthritis, couldn't hardly move. And I didn't see my friend. She went on and did something else, and she came back and she brought this poodle in, and it was hopping all over the place, and it looked like it was about 3-4 years old. And she said, I said, oh, mom, poodle finally died. She said, no, this is him. And she was laughing. She said, I think I gave him too many lymph formulas. He was foaming at the mouth and stuff, but look at him. And I'm going, it was impressive. It was definitely impressive. And I think on the YouTube, I gave out her number and stuff, but very impressive. You've got to be committed to that animal and see that animal as something you really love, and have that passion for health. So a lot of people don't have that passion for health. It's just like you said, the addiction to cooked foods is strong. The addiction to teas, and I know for tea, for me, I've been drinking sweet tea since I grew up on a farm, so to speak. So it's just, breaking some of these habits are difficult, and then it slaps you in the face, and pretty soon, okay, I give up, I quit.
Yeah.
So I don't know what to tell you other than that, is that you would find some veggies, green drinks, maybe, and pour over something. God,
She's in a lot of pain, you see, Bella, the 12-year-old with the knee operation. She's in so much pain, they've started giving her painkiller injections.
Oh my God. See,
like,
this
she
is
cries.
Yeah.
See,
they get these animals in catch-22s, just what you said. When they do these surgeries, they can't even repair the surgeries. That's what they don't understand. A surgeon has nothing to do with regeneration. The surgeon just puts things back, cuts bad things out, sticks them back together, just like a good carpenter would.
Yeah.
Who does the healing? Who's the healer here? And there you go, within the body. The more acidic a person is, the lower the steroids, the adrenals, everything else. Parathyroids are down, they just don't heal. And so you got to go endocrine glands with the dog. I would be flipping a parathyroid pill, maybe 10 milligrams. maybe one day, maybe, or break it in half, 5 and 5 and half, 1 in the afternoon, and try to get into some type of these advanced dog foods that have maybe more goodies in them and less, maybe fish is the lowest side. I don't know many dogs that like fish, but I don't know what to say. Our dogs are chicken dogs, and I keep trying to give them fruit. And yeah, my I'll tell you another good, believe this or not, our ultimate salve. The dogs are almost sucking it out of the bowl. I mean, the jar. I mean, and I have a rescue center that we ran out of the salve, and she's going nuts because all her rescue dogs just love that salve. They don't like any of the other ones, just that one. That's a regenerative salve. And so if you can get that dog to start taking that, get some salve and let them lick it, get some salve and let them lick it. It's extremely powerful salve and healing. So anytime you can move your animals toward that goal.
Yeah.
Yeah.
Even like for the
in your way.
Like even just like, would there be anything that we could do to reduce the pain? Because my mom's given her like painkiller injections, but like obviously there's gonna be side effects to that. She's in so much pain, like
I don't know how you catch-22.
Yeah.
Catch-22. And catch-22, because then you want to slip the dog brain and nerve, because she's losing her, or he's losing their nervous system with these painkillers. And then of course there goes their GI tract. I mean, everything that happens to us happens to them. And when they're little bitty things, I mean, the whole thing is tough and sick, but you work through it, you do your best.
Take care, Lisa. Take care. And before we go to Tyrone, a couple of things I want to say, Dr. Morse.